Thank you for leading the root cause analysis and for helping to identify the multiple systemic problems and errors that occurred during the care of this patient. Now, the challenge that I face as director of the emergency department is to figure out how to address and fix the identified problems. And to be honest with you, I'm not sure really how to go about this.
Have you ever worked with the team at the simulation center?
I have not.
You know, I'm thinking that they're just the people who could maybe help with. Let me see if they're available.
Simulation Center.
Damon. Hey, it's David from Risk Management. How are you?
Hey, what's up?
Hey, listen, I've got a real significant issue here, and I'm wondering if I could meet with you as soon as possible.
Sure. What's going on?
Well, we've got this case that happened in the ED that is really, I suspect that it's more of a systemic issue than just one case. Can I meet you right now?
Yeah, sure. I'll check in with Grace and be right over.
Thank you for coming. Really appreciate it.
Good to see you.
Damon, how are you?
Hey, good morning, Dave.
I'm Grace. Nice to meet you.
Hi, Demian Szyld. Nice to meet you.
Joyce Brown.
So we've got this case that came in through the ED via EMS, and this is a mom in labor, precipitous delivery. But let me start you off by looking at this video, and then I'll give you some of the details of what happened in the ED.
Here, just keep breathing. Just keep breathing.
Are you filming this?
Yeah, I got it all.
Phone away. Damn it.
Miss, my name's Andrew.
Hi.
What's your name, please?
Rachel.
All right, this is my partner, Ed. We're both from EMS, and we're going to make sure that we get you as soon as possible on your way to the hospital.
Guys, something's wrong. Something's wrong.
Well, we just need to ask Rachel a few questions real
all right.
quick.
Just answer their questions, honey.
Yes.
All right,
keep breathing.
Rachel, has your water broken?
Yes.
How long ago, please?
15 minutes.
All right,
maybe.
and when's been your last contraction?
A few minutes ago.
All right. How far apart are they coming?
Just a couple
All right,
minutes.
this sounds like one's starting right now, huh? That's pretty extreme.
Rachel, just
I
squeeze
can
on
feel
your
it.
arm while I take your blood pressure, okay?
We got a couple kids, and it's never been like this before.
Okay, well, we're going to take care of her.
Keep
I
breathing,
need you to
honey.
be there for her and help her out with her breathing and all those things that you learned in class, okay? And Rachel, I'm just going to put this on your face, just a little oxygen to help you breathe, okay? I need you to take nice, deep breaths in through your nose, out through your mouth, okay?
The way this plays out in the ED is she precipitously delivers, and then there's postpartum hemorrhage. And as you saw in the video, the communication issue continued once we got in the ED. And apparently the mom gets the wrong blood and has a transfusion reaction.
Okay, so I think we can help you, and Damien and I are going to go back to our offices and think about this a little bit, and we'll get back to you.
Okay, and we've got some summary data that we're going to send over to you guys too, and let's meet again, say next week.
That'll be helpful.
We'll
Great.
work on going through the analysis and design.
All right, good.
Thanks so
you
much
very
for bringing us in.
All right.
Thank you.
Dr. Brown,
Thank you.
nice to meet you. Look forward to
Wow, that was a really interesting meeting.
I know, I was stressed out, but I'm excited too because now we're going to be in the leadership role to teach patient safety throughout the system.
Right, so how should we tackle this?
You know, I've been thinking about that too, and I think faculty development is going to be the key in that. What do you think?
Yeah, so we wanted the faculty to teach about teamwork and patient safety. Oh, and how are we going to deal with the fact that they all work in different clinical environments? They're not all OB or emergency. That's going to be a challenge for us.
We can do a faculty development course. We'll have a didactic portion for the faculty. We'll have the faculty be participants in the simulation scenario. We'll have a debriefing portion. And then we will debrief the whole course, every portion of it, so that way, we can focus our debriefing not just on the OB case, but really on how to put a course together.
That sounds great. Let's get to it.
Oh yeah, so when they walk away, I think they'll know how to successfully build a course.
Great.
Great.
After you.
Thank you.
Good morning. So I want to welcome you to the Faculty Development course for Teaching with Simulation. So my name is Grace Ng, and this is my partner, Demian Szyld. We work together at the Simulation Center. My background is nursing and midwifery, and I do hope to get to know you a little bit. So can you please tell us your names and where you're coming from?
I'm Dr. Joyce Brown. I'm the director of the emergency department here.
Nice to meet you.
Good morning. My name is Ed Kolkloff. I'm the director for the medical technology program.
Hi, Ed. Good morning.
I'm Kevin Webb, chief of the paramedic department.
Hi, Kevin. Good morning.
And my name is Regina Arnold. I'm the director of the emergency nursing department.
So we have 3 objectives for this morning. The first one is to implement safe blood transfusion practices to achieve 0 error rates. The second one is to incorporate and implement situational monitoring. The third one is to select effective communication strategies in a teamwork situation. So before we jump into the simulation, I like to set up some ground rules for us. So whatever happens in Foxwoods stays in Foxwoods. So as we're in the course, we are in a free, safe environment to discuss our mistakes and what we could do better. So that's ground rule number one. The second thing is I ask you to keep confidentiality about this case as well, because we're going to be running this with some of your other colleagues as well.
I'd like to orient you a little bit to the environment. So I'd like for you to step over here. This is Rachel. She's going to be your patient for today. As you can see, the simulation environment is pretty realistic, but not exactly real.
This thing's amazing.
Rachel is a patient who breathes and talks, and you can interview and examine her.
Has a pulse.
You can do some procedures on her. It's not exactly the same, so you do feel a pulse. It may not be exactly where you expected, and some things might be slightly confusing, but we try to do our best. We have a code card and a monitor and most of the equipment. We have some actors too who will help keep you oriented and also add to the experience. Given that it's not exactly realistic, we just ask that you kind of enter into a contract with us and agree to take it seriously and do as you would otherwise, and we'll do our best. If I can just get a little nod in agreement. Yeah, our goal now is to have you take care of the patient, so I'll ask everyone but Regina to step off, and I'll give you a little summary. You're called to see a patient in the emergency department. She was a 33-year-old woman who came in labor, and she had a precipitous delivery in the ED, and baby did well. He's up in the NICU. You're called because the patient and father have a question for the nurse.
Okay.
Okay.
Great.
Any questions?
Nope.
Great. Good luck.
Thanks. Hi, sir. My name's Regina. Hi. I'm the nurse for Rachel today. You're Nick. Nice to meet you. What seems to be going on? You rang your call bell. I was just getting a report from the other nurse.
She just gave birth a couple hours ago, and right now she's not doing too well. You could hear her moaning, and she just doesn't look well. I'm wondering if there's something wrong with her.
So her eyes aren't open. Has she fallen asleep lately? Ma'am. She's just moaning.
Yeah, I think she's in pain. I'm not really sure, but this is what we saw
okay.
last time she gave birth.
Give me a few minutes to just check her out. She is breathing and has a pulse. Let me call for some help, and we'll get her all checked out. Ed, would you be able to please grab Dr. Brown for me? Her patient is unresponsive.
Dr. Brown, right away.
Dad, I'm just going to get some vital signs on your wife and make sure that everything is going okay. These things can happen, but we definitely want to check her out. Okay, ma'am, we'll try and get you some help. Okay, the doctor's on his way.
Dr. Brown's on her way. How can I help, Regina?
She seems to be only responsive to pain, doctor. Her vital signs are a little bit different than the last nurse reported to me. She's a little bit tachycardic and her blood pressure is only 93/57.
Okay, if we can put her in Trendelenburg, that would be great.
Okay.
Hi, sir. I'm Dr. Brown. Nice to meet you. Congratulations on your child. I hear he's up in the NICU doing really, really well.
Some oxygen, doctor?
That would be great. 15 liters, non-rebreather, please.
Ed, can I have
Looks like your wife's having a little difficulty, so I'm going to take a minute and examine her and try to figure out what's going on and see how we can help her, okay?
Thank you.
Sure.
Something's not right.
Hi, ma'am. It's Dr. Brown. I'm just going to take a look at you. So it looks like her airway is open and she is breathing. I'm going to take a listen. Even though we are putting oxygen on her, her oxygen level is normal. This is just to give her a little bit of extra support.
Are you going to want an exam?
I am. If you could get set up for an internal exam, I'm going to need a speculum and maybe get some backup for packing.
Okay, Ed, would you put the bed into stirrups position and I'll get her equipment?
Is everything going to be okay? Everything sound okay?
We're going to do our best. I'm just going to examine her belly now. Ma'am, I'm going to touch your abdomen. Oh, wow. So her abdomen is a little bigger than I would expect it to be after having a baby. Usually your abdomen is supposed to get smaller very quickly. It's supposed to contract down. And when the abdomen contracts down, that stops
Oh, doctor,
a lot of the problems.
We've got quite a bit of bleeding here.
Oh, no. Sir, your wife is bleeding a little bit. The doctor's going to start some emergency procedures and care.
Okay. Is she going to be okay?
We'll definitely keep an eye on her. And for right now, she's still breathing and her vital signs still look okay. Would you like the IV opened?
Yes, wow, there is a lot of blood here. I'd say we have at least 800 cc's of postpartum hemorrhage. I would like the 2 liters wide open. I also want a type and cross for 4 units of PRBCs. I would like FFP and 1 pack of platelets. I also want a CBC, CMP, and a coagulation panel right away.
Okay, Ed, I'll call the blood bank if you could draw the labs for me.
So
and
as I'm
also
doing
start
this external
the IV
exam,
in the right arm for
sir,
me.
there is good news. I don't see any active lacerations or cuts. I don't see any active trauma. Externally, she looks okay, but I am going to go ahead and do an internal exam. Do we have a speculum?
You know why she's bleeding? What's
That's
wrong
what I'm
with her?
trying to determine right now. I don't see any cuts on the outside. I'm wondering if it's her uterus. Ma'am, you're going to feel me go inside of you with the speculum. I know it's uncomfortable. Just do the best that you can. And sir, if you want to help me out by comforting your wife and maybe holding her hand and letting her know what I'm doing.
It's going to be okay, honey.
So ma'am, you're going to feel the speculum going in. So as I'm looking, I don't see any lacerations. I don't see any obvious retained products in here. So I'm going to go ahead and do the internal exam. Ma'am, you're going to feel my fingers going into your uterus. Wow, there is a lot of bleeding in here. I want that type and cross, but I also want 2 units of ONEG right away.
Okay, I'll call and update them. Here's a gown for you.
Ma'am, you're going to feel my hand. Okay, there is no uterine inversion present, so that's a very good thing.
Yes, hello. We have a
That's
hemorrhaging
good
patient
thing.
in the emergency room.
The uterus
I need
is
that
very
patient
enlarged.
to be
It's
2
very
units
boggy,
of O negative.
so
I'm going to send my tech down to run and get that.
I'm going to go ahead and
okay,
start
thank
something.
you. It'll be ready in about 1 minute. Thank you.
Regina, the IV's running. It's wide open. I've got the samples. I'm going to run right down the lab and pick up
Okay,
the blood.
pick up the 2 units of O negative. We've changed it from a type and cross.
Okay.
So what's wrong with her? Did you find out yet?
Her uterus is very enlarged, so I'm doing a massage to try to get it to contract down. Nurse, when you have a moment, to also help the uterus contract, I would like 10 units of oxytocin IM right away, please.
Okay, I'll get that out. Her blood pressure has dropped to 60/40.
Okay, and I would like another liter of normal saline wide open. And
Okay.
sir, if you don't mind, see that packing that's at her head? If you could hand that to me. And what I'm going to do while we're waiting for this medicine to start working, I'm going to take this gauze and I'm going to put it inside her uterus to try to slow down the bleeding a little bit.
We have about 400 cc's in already, and I'm drawing up the
Dr. Brown, I just
oxytocin.
wanted to stop by to see how the patient was doing from this morning.
Hi, thank you so much for checking in. The baby's actually doing great, but
Excellent.
the mom is having what I would classify as a severe postpartum hemorrhage from uterine atony.
Okay, let me just go ahead.
Is there
and
anything that
So do you want me to hang a
you remember
hang a leader?
that
Do you want me to hang it hanging?
Let me give this
Well,
injection
I
and then we'll
believe
go through the
our
checking
primary
process
assessment
together.
was
this
we
over
responded
here
to the
and I'll go to the
driveway
other
of her
side,
house. Her water had broken inside her house. Any staining appeared to be normal. She was conscious, alert, and oriented, and she was probably about 8 centimeters dilated at our point, and then we initiated transport. I noticed she was hypotensive, so we initiated a 14 gauge in her left AC, about 500 cc's of fluid during a 15-minute transport.
And there was no trauma, there was nothing en route that could have caused this?
All the surveys were negative.
And sir, after she delivered your son, she didn't get out of bed, she didn't fall, there was nothing that happened?
No, everything seemed normal right after she gave birth. I don't know what happened.
And I did get a report from the other doctor, but I just wanted to confirm your wife has no medical problems, she has no allergies, and she takes no medications besides prenatal?
That's all correct.
Okay.
Dr. Brown, the oxytocin is in and I'm hanging the blood. Ed, you're handling the other blood bag?
Yep, it's hooked up. Can I start it?
Sir, you signed the consent prior that your wife could receive blood. Are you still okay with that?
Yes, I'm still okay with that.
Okay, it's 2 units of O negative.
And do we have a repeat blood pressure, please?
Sure, I'll get that for you in 1 second.
As well as a heart rate?
Okay, so I've got the blood wide open.
Okay, so 2 units of blood are going in wide. And our next blood pressure is coming up. Her heart rate is 124. She's 100% still on the oxygen. We have about 800 cc's of saline in 1 bag, and so about 1,200 total, and the blood is going in wide.
Her uterus does not feel like it's contracting down well for me. If you could give Methergin, 0.2 milligrams IM right away.
Yep.
And also, if you could consult Gyn Surgery, tell them that we have a 33-year-old female with no significant past medical history, immediately postpartum with a severe postpartum hemorrhage. I'm suspecting uterine atony, but I need them to take her to the OR to maybe look for retained products.
Okay.
0.2 milligrams methogen.
Yes, IM times 1, thank you.
And her blood pressure is 80/48.
And sir, just to let you know what's going on, your wife, her blood pressure is continuing to go down a little bit despite what we're doing. I am going to continue doing the fundal massage and pack her uterus to try to stop it, as well as giving her the blood and the fluids and the medication. But I do think she's going to have to go to the operating room so they can do a full exam and make sure that there's no maybe small piece of placenta that got
Ed,
left
would you
in her
massage
uterus
that for me,
that's
please?
preventing
Thank
it
you.
from
While I take care of this
narrowing
needle.
down. Ma'am, are you doing okay? So she's still moaning and responding to me. So even though she's in
She is
pain
still
and I don't like that
moaning,
she's
yes.
moaning, I am happy that she's verbalizing and responding
Okay,
to what
everyone,
I'm saying.
we're going to end the scenario right here. OBGYN is here to take your patient off to the OR. We'd like to move towards debriefing. So if you would just step over here with us.
Ma'am, I'm just going to cover you back up.
The OB
Okay,
team will
yep,
take care of the
team will do
patient. She's going to do great.